I'm doing this to make people aware of what can happen with the COVID vaccine. I'm not saying don't get it, I'm just going to tell you about our experience with it. My father, Joe, was 87 years old, a wonderful, lovely, happy man, leading a really lovely, happy life. Yes, he had carers, but he was up every day, he was out every day, and before lockdown, there wasn't a time that he wasn't in. He had a better social life than most of us. During COVID, obviously, there was restrictions, but he was still well, happy, and yes, on certain medications, and he had a condition where he wasn't able to mobilise himself, but again, totally stable. I was against the vaccine initially, but on the advice of his doctors and me being told that if I didn't get him vaccinated, then I didn't have his best interests at heart and he wouldn't be able to go out and lead his life. So after much soul searching and speaking to family, his carers and his doctors, we decided that we would get Joe vaccinated. And Joe was vaccinated on the 30th of December 2020. Within 2 days, we started to notice that Joe had completely gone off his food, and that wasn't like Joe. He used to eat everything and a bit more. But he just became so different, and very, very quickly the mental decline was like nothing you ever saw. Obsessive behaviour, and going from somebody really on the ball and singing and happy to somebody who couldn't coordinate his thoughts or his obsessions, and just something that was like night and day, like we never saw. This got so bad, I knew that we were dealing with a vaccine response. He couldn't get out of bed. He couldn't breathe. He couldn't swallow. He started to be sick. At this point, I knew that we were going to hit some problems, not both with what was happening as a result of the vaccine, but also through it being a vaccine response. I put a record app on my phone, and from that moment I recorded everything with Pfizer, his doctors, paramedics, hospitals and everything. So I do have all the evidence to support what happened. Joe got so poorly, he was taken into hospital. We tried everything to keep him out of hospital because our experiences with hospitals weren't good. It was confirmed that the carers could be in the hospital and my sister could be in the hospital and I would have access to the hospital. But very quickly that all changed. My sister went in the day after admission, and she got surrounded at Colchester Hospital by 8 people. Now my sister Tina is actually autistic, so it's absolutely so frightening for her. They surrounded her with 8 people and got her off the ward. We weren't allowed on that ward. I then had to work really hard to try and get him out of the hospital to see if we could get him into another hospital. I managed to do that, and Joe had his condition had got worse, and he was now vomiting jugfuls of blood. I mean, horrendous amounts of blood. He was so ill. We then trusted and we got him to Broomfield Hospital at Chelmsford, where we were told he would be under a gastro specialist and he would be put onto a gastro ward, that carers could be with him, and we totally trusted this hospital. Joe, before admission, had a COVID negative test. He actually had 2 COVID negative tests. My father was taken in the ambulance into the hospital, and before we knew it, we could not get access to him. I then spent from 5 o'clock in the morning until 10 o'clock that morning trying to get answers and trying to get us onto that ward. Nobody had let us in. We did everything. We were blocked. Nothing would happen. We were frantic, not knowing what was going on with Joe. The following day, I finally got through to somebody, and they said that he'd been put on a ward, and I said we would be in, and we were told we couldn't go in. And when I asked why, they then told me he had been put on what is called a red ward, which is a COVID ward. Obviously, I lost the plot because my father had a negative test. My father didn't have COVID. He was put on a ward with people with respiratory illness, and he was then taken off of all of his life-saving medication, and without our say-so, he was then treated for COVID. He had no symptoms of COVID. I managed to speak to him. He had no symptoms of COVID. I have all the recordings. His oxygen saturation was normal. He had no symptoms of COVID, but he did have symptoms of gastric bleeding. Before I knew it, all of his care had been totally stopped. He had been put on dexamethasone. He had been put on IV antibiotics. He had been put on IV fluids. He had been put on so many things that come from centralised government, which was the standard treatment for protocol. I fought, and I fought some more. After a few days, we finally had a journalist that helped us, and we got onto the ward. What we saw was so traumatic. We are struggling with this because our father was like something out of a concentration camp. He'd not been given fluids. He'd not been given his medication. He'd not been fed. He was covered in bruises. He had no lips left. He had all of the inside of his mouth completely gone. And we didn't realise, but he was now at the end of his life. And we begged for them to help. We begged for them to give him palliative care. Nobody came. A carer and my sister Tina was on the ward, and I was on FaceTime with him for the last 24 hours of his life. I'll just confirm they did not even give him the basic of care at Chelmsford Broomfield Hospital. He wasn't even given any sedatives, no palliative care, nothing whatsoever, not even water, only the water that we gave him. By this time, it was horrific. What my father had to endure, it was nothing more than murder. What they did to him was nothing more than murder. I am not dramatising this. I can show you every photograph. I can let you listen to every recording. I can give you witness statements of people in that hospital, the carers, and everything that we saw. We have videos, we have everything. Now for us, moving forward, it's so traumatic. But there's a combination of many things here. You have a vaccine response that becomes a hot potato. Nobody wants to deal with that. So what they do is they ensure that you can't get to that patient. Then it is almost like they are chosen to be on these wards. The staff on these wards are not like nurses that we have ever seen. You will not get past them. You will not get past them. My father's death, as I say, was horrific. But you do need to know what is going on in these hospitals. This is not an isolated case. I am part of a support group where we have dozens and dozens, going into the hundreds on these support groups now, where the same is happening, not only to vaccinated patients, but also to elderly in these wards. The elderly and vulnerable, they are not looking after them. They are killing them. I am not dramatising this. This happens. This happened to us. And on my father's ward, and remember he was on a COVID ward when he was COVID negative, I have recordings where nurses have actually stated to me that people on that ward, nearly every one of them had had either one or both injections. So what I am saying to you, please weigh this up. Is COVID such a threat to you and your family that it's worth getting an experimental vaccine? It is experimental. It is still not licensed. It is still in clinical trials. You are the clinical trial. You cannot undo this. If you are given this jab, you cannot undo this. Please remember, less than 1% of COVID patients die. And even then, they're actually stating a huge amount of those aren't from COVID. They are false deaths. So you probably have 99.5% of people surviving COVID, or what they deem as COVID, this respiratory illness. We are now looking at more than 1% of people dying from the vaccine. And we are looking at hundreds and hundreds of thousands of people who are having life-changing conditions from the vaccine. If you don't believe me, please go on support groups. Within a week, there was 112,000 people joined one group that was taken down off of Facebook. So, if you don't believe me, don't believe me. This is your choice, but this is our experience, and it isn't something that we can hold on to. It has to be shared. People have to know. You cannot just see the government side. You have to look at life from both sides. You have to look at this from both sides. So, please make the right decisions. Do your research. You have had over a year of this COVID, and you've had over a year to research this. I actually say to you, I was really scared at the beginning of COVID, but from what I've seen, not only with my father, but with others and with people on the ward and what we've experienced, I and everybody within our circle would take our chances with COVID. And in fact, a huge amount of people we know have had COVID. Every one of them, bar one, has survived, and she had severe kidney problems. She actually had a kidney transplant. Yes, we have seen people really quite poorly from COVID. I'm not saying anything different, but again, please weigh up and look at both sides of this. Thank you for listening to me. And if you need to contact me for support, which helps both you and me through this and my family, or just for any evidence, I will be part of a documentary and I will be speaking out, because I can't sit and live with this and not pass this forward. Thank you. God bless.
You know, during the clinical trial, there were no serious adverse events reported that the independent drug monitoring committee were concerned about. So because it's a new vaccine, there isn't and with any vaccine other than sort of anaphylaxis, we don't have sort of medical instructions or directions for responding to any particular side effect as such. It's just very much down to normal clinical practice. Good afternoon, from surgery.
Hello there. I've been in contact with Dr. Nemeth a lot because my father's had an extreme adverse reaction to the COVID vaccine.
Okay.
Now, I'm in a position where we actually don't know what to do now. Sorry.
Oh,
but I don't know.
it's okay. Don't worry.
I've got to have some help. We've got to have some help. The whole thing started with the injection, the COVID injection, yeah. And then, obviously, we went, so had the COVID. It was a totally up, happy, well, kind of just up and laughing every day. Really, really well. Had the COVID injection. 2 days after he had the COVID injection, took to his bed, couldn't breathe, couldn't speak, couldn't swallow, anything like that. This is just due to what's happened since the vaccine, really. So we don't know what we're dealing with.
Well, yeah, I totally understand what you're saying. I mean, normally in a normal situation, if someone's bringing up old, because he was literally vomiting old blood yesterday. I saw it there. He vomited. Well, you saw it as well, because I know you have the camera. So that would indicate that there is bleeding going on, probably in the stomach or in the gut.
The sickness, he was totally well, but now he can't move, he can't do anything, and it's going between the different symptoms. The sickness started at 11 o'clock last night, and I would say over 100 times he's been sick since 11 o'clock.
Yeah, that's what the girls were saying here, yeah.
So obviously Dr. Nemeth's been in. I've been speaking with Dr. Nemeth all the time.
We know he's having a GI bleed at the moment.
Yeah.
And people with GI bleeds can deteriorate very, very suddenly.
One of my colleagues that's just come to support me, her husband works in the hospital and he was given his vaccine, and she said he had it on a Wednesday and by Saturday he was absolutely sick as a dog. And so I definitely think we are obviously giving a little dose of the COVID to the patient. They have a vaccine.
I don't believe that my father's even basic care needs are being met at the moment.
Right, but this is a red amber COVID ward, so we are very busy.
You've got my father on a red amber COVID ward.
That's what this is. This is AMU red amber.
So you've got my father. Can you confirm that Joseph Hayes, you've got my father on a red amber COVID ward?
Yes, he's in 17, which is a side room.
But my father hasn't got COVID.
Sorry, Ria. I mean, I really want to do what's right for your father.
Right.
I'm not able to. So I think for the trust.
You're not doing what's right. You have completely. I have got nurses. I've got every recorded telephone conversation with your nurses. You have even denied stating in an email that my sister and carers were allowed on the ward. You even had my autistic sister surrounded by 8 people and escorted off of the premises. My father, Joseph Hayes, the carers in there with him, do you actually leave your patients to scream that they're dying every night? Is that what you do?
I don't know that he's screaming that because she hasn't told me. She asked me to go in to see him, which I did, and he told me that he wanted his tablets. I told him that he wasn't due any tablets, that's why I hadn't given any to him. And when
what you need to do, obviously, it sounds to me, and she's horrified, she's never seen anything like it. So what you need to do is call a doctor, and you need to give him something like